Welcome to another episode of Bula Wellness on FBC TV. I am your host, Dr. Neil Sharma. I acknowledge all our viewers from across the country, from the west, north, and the outer islands, and not forgetting our great central and eastern corner of our beautiful nation. This week, we talk about mental health. Later on in the show, we have got a guest who is a former WHO director, Western Pacific Far East, in mental health and is currently a professor at a Malaysian university, Professor Dewa. That and more later on this show today. Mental ill health is a very important non-communicable disease. The World Health Organization reckons that by 2025, it will rise above diabetes and will be the leading NCD globally. With changing lifestyles, we are facing a lot more stressors, and some of that leads to major distress. Stress and distress leads to psychological pressures, which in turn leads to anxiety and depression in a lot of individuals today. In many parts of the Pacific, there isn't even a trained nurse to attend to the rising number of cases of mental ill health. In Fiji, we face a crisis of sorts with limitation of all levels of service delivery. This evening's program will focus on how we can prevent mental ill health. We aim to raise your awareness, hoping to raise your attention to seek help early, being screened earlier, and return to normalcy without affecting the quality of your life long term. Historically, St. Giles Hospital was established to cater for expatriate communities' needs in the early 1900s. The nursing role was provided by a group of expatriate wives with little formal training, under the supervision of an expatriate doctor of the British Civil Service. Over time, local nurses graduating from the nursing school were engaged to serve as the services expanded for our local population, and with locally trained assistant medical officers becoming the service providers. The concept of mental ill health was confined to inpatient care of major psychiatric issues like schizophrenia, personality disorders, and later criminal cases. Additionally, cases of cerebral palsy and other non-mental or medical handicap were provided accommodation at St. Giles, as the Department of Social Welfare was under the jurisdiction of the Health Ministry then. Some of these patients have been resident in this facility for up to 50 years even now. The area of mental health has suffered with great health manpower shortages, poor planning of service delivery, and medication supplies which are erratically sourced. The 2009 to 2014 period was a milestone for Fijians with mental ill health. It was during this period that the archaic mental health laws were modernized, and some of those are still being progressed and now ready for WHO review. The process of decentralizing of healthcare was in progress, and the 3 stress wards were opened at the 3 base hospitals, not without great resistance, to make the services readily available in a non-stigmatized environment. The aim was to offer the extended services to anxiety, depression, parasuicides, and personality disorders, patients of old, decadent inpatients St. Giles Hospital. Additionally, improvements to the St. Giles was undertaken with a new ECT machine, fully operational, and a general infrastructural makeover. The decentralization of services also saw satellite clinics in the subdivisions in Navua, Singatoka, Nandi, Ba, Rekereki, Senganga, Savusavu, being operational by teams from Suva, Lautoka, and Lambasa. The restructured postgraduate training of nurses and a totally new postgraduate diploma for doctors was commenced. This was the icing in the cake with international accolade for the Fiji health system. The combination of law change, decentralization, and commencing of a postgraduate training program has seldom been effected elsewhere. The Asia Pacific Federation of Psychiatrists acknowledged and recognized the great strides Fiji had undertaken.
Mental illness is the leading cause of disability worldwide. It is also the best kept secret. Mental illness is so common that 1 out of 5 people grapple with very real mental health problems at some point in their lives. The majority of them never get treatment. They suffer silently, living among us. Their mental health needs remain hidden in plain sight. People with mental health problems experience distress and suffering. Keeping up with school or work is overwhelming. Relationships with family members, co-workers, and friends become problematic and burdened. Mental illness affects many, and when it does, it isn't pretty. So we prefer to look away, allowing mental illness to remain hidden in plain sight. We might think this dismal state of affairs is regrettable, but ultimately forgivable given limited resources. Until we consider that affordable, effective treatments exist, until we consider that ignoring these problems costs more than caring for them, until we consider that when we fail to treat individuals who suffer from mental disorders, we all lose. It's time to focus on mental health. No more hiding.
We are privileged to have Professor Deva, a former regional advisor on mental health for WHO in the Western Pacific and Far East area, and is currently a professor at a Malaysian university with us today. He is here to shed more light on this issue after a lot of us here in Fiji especially take for granted, and I hope that this discussion, you, our viewers, will get to understand this illness better and also educate your peers, friends and family. Welcome, Professor.
Lisa Bula, Dr. Sharma, thank you for having me here.
Just to let things going, what is the difference between mental health and mental illness?
Well, I think we all know about physical health. We have to keep ourselves fit, we keep ourselves active, and look after our diet, don't eat too much, and so on. But when it comes to mental health, very few people know what mental health is. Mental health is deals with the health of the mind and your ability to cope with stress and carry on a useful life in whatever position you are. For example, if you're a family man, you should take responsibility for looking after the family, doing work. If you're a working person, you should be able to do your work without too much stress and cope and contribute to the well-being of the nation.
Thank you. Thank you for that insight, Professor. Very interesting topic, and I'm sure our viewers today will agree with that too. We discuss more after a short break. More coming up after this. Welcome back to Bula Wellness on FBC TV. We have Professor Deva with us today, and we are discussing mental health. Welcome again, Professor. With any sickness, I'm sure that most of us have signs and symptoms. What are some common mental health signs?
Actually, the commonest mental health signs is usually the first thing that affects people when they are stressed is the lack of sleep. The moment you start having lack of sleep, you find you're not sleeping as usual, that means something is wrong. Sleep is like appetite. When you need it, you must have it. So if you're hungry, you need food. If you need sleep, you'll automatically fall asleep. But when you suddenly find that your sleep is not as usual, and there's no reason for it, you just toss and turn and don't have the usual 7 to 8 hours of sleep, and when you get up, you may have slept reasonably, but you get up, you feel tired. You feel as though you're not slept at all. Okay. This shows that there's something bothering you, something troubling you, some mental health problem.
Thank you. Would you be able to give us some statistics on the global position, region, and in Fiji on mental ill health?
Well, basically, I think there's a lot of misunderstanding about what mental illness is. I think you mentioned earlier about how much difficulty you had trying to transform the mental health services in this country, a lot of resistance, because most people in Fiji, including sadly professionals in healthcare, feel that mental health, a mental illness means you're mad. That means that is actually dealing with the word psychosis. Psychosis deals with only about 1% of the population. But when you say mental ill health, you're really talking about something like about 15% of the people who are ill at any one time due to a wide variety of problems not related to madness or psychosis. For example, stress. I think lots of us face stress every day, whether you're working at home, whether you're driving, traffic jams, all sorts of things. But most of us are able to cope. But a significant number find that that stress is too much for them.
Okay. Now, taking it further from there, what are the difficulties individuals and families face which give rise to mental ill health?
Well, I think the biggest single thing is disappointment or loss. If you look at, basically, when I talk about mental ill health, is anxiety, depression. Anxiety is basically worry, depression, and psychosis. Then, of course, there's substance abuse and child psychiatric problems. Among these, anxiety and depression are the commonest. And many studies have been done all over the world by the WHO that shows that depression, anxiety and depression are some of the commonest mental health problems that everybody faces. But it's not madness. So what happens is, when they have this anxiety and depression, they feel unwell, but they can't put a finger on what is troubling them. Sometimes they complain of headaches, sometimes they can't sleep, sometimes they feel tired, they feel they're not themselves, and they go to a doctor, and most doctors or nurse practitioners, in many areas of the Pacific, there are not enough doctors, they say there's nothing wrong with you, because they take the blood pressure, they take a temperature, and they find there's nothing wrong. So they tell them, no, there's nothing wrong with you. But what they don't understand is, nothing wrong physically, yes, but a lot of things wrong mentally.
Thank you. What are some cultural beliefs which can become barriers to seeking early medical support?
I think what happens is that traditionally, I mean, Western medicine is a relatively new thing in most parts of the developing world. I think even in Fiji, Western medicine would have come in the mid-1800s or so. St. Giles was set up in the late 1880s. So you can see that the access to Western medical care, whether it's for physical illness or mental illness, has been extremely slow in developing. So there's already an alternative system, whether it's traditional healing, using herbs. Throughout the Pacific, a lot of people are using herbs for all sorts of stress-related problems. And then on top of that, there's also some religious healing. A lot of people go for religious healing. We did a study in Malaysia, and I think it's similar here, that about more than 65% of patients who come to a psychiatrist for a mental health problem have seen others before. They have gone to everybody, including general practitioners, and most of them have not had relief. That's why they come for something more. The number of patients who come for psychosis is extremely small, but lots of people come with headache, stomachache, backache, not feeling well, not sleeping well, not eating well, cannot concentrate on the work. This kind of thing is very common. And if they take medical leave, the boss will turn around and say, how come you're taking so much medical leave? But that may be the result of stress. This is a very under-recognized.
Yeah. Prof, when should the family get in concerned about with the signs and seek medical assistance?
You're right. Actually, the family plays an extremely important part, because they are close to the person who's having stress, whether it's the husband, whether it's the wife, whether it's the children, whether it's mother-in-law, whether it's relatives. They know the person's behavior all along, and what is his normal behavior. He may be cheerful, happy, everything. Suddenly you notice that he's not taking interest in his work. He goes out regularly to play rugby, now he's not interested in rugby. He goes out for a drink with his friends, now he says, no, I don't want to meet anyone. That is an early warning sign that all is not well. And rather than say, no, pull your socks together, go out and go for a run, ask them, is there anything troubling you? Recently, the WHO came up with this big program to publicize the importance of detecting depression early. And the slogan is, let's talk.
Let's talk.
So the family, actually by the time he goes to a doctor, the doctor doesn't know anything that's going on. And by the time he takes the history, that will take hours, where the family knows exactly what's troubling him.
Okay.
Where recently he has had a loss, he had a problem, financial problems, or he's stressed at work, he wants to change his job, or he's been sacked from his job. Those are the things that bring about the stress.
That takes us to the next question. Do you think doctors in Fiji are making a diagnosis of mental ill health early enough?
This is not only Fiji, but I think I've done studies actually in several countries for the WHO. And the detection rate of significant stress-related psychological problems is usually around 3%. The figures in WHO show this much higher, but in my experience, most GPs know very little about stress and mental illness. All they know is psychosis. When the person becomes psychotic, aggressive, violent, shouting, taking off his clothes and accusing people and all that, then they know, oh, this is mental illness. Now, I have actually worked in about 8 or 9 countries in the Pacific, plus the mainland of Asia, in Malaysia, in Mongolia, in China, and I have again and again come across it that no matter what your teaching program is in the medical schools, most doctors are nowhere near detecting what is like 25% to 30% of their patients who have got significant psychiatric problems which need attention. Everybody has stress. Nobody has no stress. Even my cat has got stress. Everybody's got it. But when it reaches the level where you cannot cope, you cannot concentrate on your work, your boss pulls you up and says, how come you're not done your work? This is a regular worker, he's a good worker. Last 3 weeks he's not doing his work. He's coming late. He wants medical leave. These are the patients that GPs should, family doctors should be able to detect and pay attention to.
Okay. What are some stigmata attached with St. Giles in Fiji, having worked in Fiji for a consultancy?
Almost a year with FNU and with the Ministry of Health, yeah. Well, I think, the first and foremost I must say that Fiji has been left behind in the field of mental health. Mental health has advanced even in the developing countries of Asia much more than what's happening here, in the sense that the services are available throughout the country. Now, one problem in the Pacific is that all these islands, the 300, I think, populated islands in Fiji, it's not possible to approach all of them very easily. You need an enormous amount of funds to have transport and then replicate the services in every island. So what happens is, in a place like Fiji, the availability of mental health human resources is very little. Of course, you can't expect a psychiatrist to be in every island, but every nurse practitioner, every family doctor, and there are many of them. At last count, I heard about 450 doctors and something like about 2,000 nurses in Fiji. They can all be trained to detect signs and symptoms of stress and attend to that with simple, I've in fact come out with a simple classification of all psychiatric disorders of primary care called LIMA: anxiety, depression, psychosis, substance abuse, and child and adolescent problems. Okay. Using that method, we can actually at least detect and then ask for help, because there are now about, I think at least half a dozen or a dozen psychiatrists now with a diploma level at least, and they can be approached by telephone. Everybody's got a handphone, ring up and say, look, I got this patient who's a chronic aches and pains. I've done every test, ECG, everything is normal. What do I do? So, is he having difficulty in sleeping? What about his appetite? He may be depressed. So I'll tell you what medicine to give. So a kind of supervision of the outlying clinic doctors is most needed.
Fine. Prof, finally, your thoughts on support groups within the community.
Absolutely. I think that's imperative. You don't have to go to a doctor to detect this. The family can detect. But many people are still very averse to going to see a psychiatrist. That's why I feel that the family doctors play an important part. But also, there are many people with more severe mental illnesses who are discriminated, who are neglected, and who are tortured by people who say, oh, this fellow is mad, he's crazy, he's running out of his mind. These people can be helped by support groups. Now, we were lucky that in 2011, no less a person than the First Lady of the country actually opened the Fiji Alliance for Mental Health. Dr. Odile Chang did a fantastic job gathering the people together, and 4 support groups are joined together under the Fiji Alliance for Mental Health. And they can play a very leading part in spreading the message about mental health, early detection, and even like set up day centers, which can give them a lot of support. So these are very necessary in Fiji.
Thank you, Prof,
Thank you.
for your time and availing yourself to come today. Even though I know you have a really busy schedule with your lectures and advocacy for mental health. All the best with the rest of your stay in Fiji and safe travel back home. Thank you once again.
Thank you, Dr. Sharma. Vinaka.
Earlier, Professor Deva highlighted several important prevention and early patient management issues. Let's make an effort to take home some of these important ones. Mental ill health is a serious non-communicable disease which is taking its toll on young and old in these modern stress-related times. It is extremely worrying that we are still struggling with other communicable and non-communicable diseases with the added burden of mental ill health compounding them now. World Health Organization is now projecting a further steep increase in mental ill health in association with the health impacts of climate change in the Pacific. The statistics demonstrates that there are increasing number of cases in need of counseling and proper treatment in hospitals, the community, in the home. Close to a third of our patients in the outpatients department need some mental health support. This is unfortunately being missed in our health centers, clinics, and hospital settings. Anxiety, depression are not being addressed in the community, hospitals, and in all other settings. People are left to cope on their own, and over time, long-term complications set in. We note increasing number of parasuicides and suicides. That is one effect of us not paying attention to people around us. Dr. Deva rightly explained that disturbance of sleep was an important indicator of stress, distress, anxiety, and depression. So if you or a relative or a friend cannot sleep well, then please seek assistance early. Sleep deprivation is an early warning to mental ill health. Additionally, if you have lost your appetite, losing weight, losing interest in events normally undertaken, or not enjoying social events that were previously enjoyed, seek help. Something is not right. The question remains, are we preparing ourselves, our families, and our communities to deal with this crisis? Our guest, Professor Deva, has discussed ways of leading strength to our life in preventing mental ill health. Professor Deva discussed the social beliefs in people seeking assistance from witchcraft and sorcery, the belief in the evil eye, the evil spirit, that sorcery was undertaken widely and of which many witch doctors are making a grand living out of people's misery. It's time we educate each other and changed our paranoid vision of life and consider established mental ill health as a personality disorder, as in drug abuse, and mental ill health in its entire spectrum: anxiety, depression, substance abuse, adolescent disorders, and schizophrenia. He discussed ways to find social support. The importance of proper medical counseling was also addressed. We have barefoot counselors largely. Unfortunately, properly accredited medical counselors are in short supply, as the relevant authorities may not have fully looked into this area. This is an area of need, surely. Whilst addressing ways and means to seek help, he applauded the opening of the stress management wards and the peripheral mental health clinics in 2009 to 2012, but was greatly saddened when it was brought to his notice that these clinics were possibly not operational and that the psychiatric team was now much smaller and poorly staffed, barely coping with the workload. psychiatry was not any longer given the priority which is needed to develop as a nursing and medical specialty. Professor Deva talked on the need for improved social community support by NGOs, faith and religious groups in his presentation, and later to health professionals. He rightly stressed that all patients need to return to their homes and the community. We cannot separate these individuals from their next of kin like other individuals with diabetes, hypertension, or cancer. We cannot use the current model which the manner of treatment has progressed globally. Mainlining mental health care with community-based programs, daycare services, and short-term hospitalization in general ward settings are now established normal in developed countries. Mental health institutions are used more short-term for serious cases, inclusive of the criminally insane. It is most unfortunate that our psychiatric rehabilitation facility hasn't been relocated or opened up regionally, despite the technical support from WHO. New services can only develop if we start afresh. Well, time has caught up with us again, and this has been an exceptionally interesting discussion, and we hope you will keep an eye out for individuals, family members, and ones in the community who need to be supported. If you have queries about the show or the topic today, you can contact us on Facebook Bula Wellness, FBC TV, or write to us at bulawellness@fbc.com.fj. Make sure to join us again the same time next week for our next episode. Until then, goodbye for now.